Hello everyone, welcome to Interview with Experts Season 5, proudly presented by the Malaysian Dental Students Association MDSA. I am Shunyi from the Academic and Research Bureau of MDSA. Today, we are very honored to have with us Professor Dr Ngeow Wei Cheong, a very successful and experienced oral and maxillofacial surgeon from the University of Malaya. Good morning, Prof Ngeow.
Good morning, Sunyi.
On behalf of MDSA, thank you for accepting our invitation to be our special guest today.
My pleasure.
First of all, could you please begin by telling us a little bit about your beginnings and how you ended up as a lecturer here in UM?
So I was interested in maximal dentistry. Of course, obviously, because of the number of schools that is less, our options are less, and I was in a way lucky to get into dentistry as a second choice. So immediately, a lot of people as dentists in my generation get into dentistry as a second choice. So either that or maybe pharmacy. I think there were one dental school, 3 medical school, and 1 pharmacy at that point. So I got into dentistry and I graduated at 92, where I actually work in a private practice. I work with a very famous doctor actually, Dr. Sintang Eng. He used to be the founder and the president of Malaysian Aesthetic Dentistry Association. So I work for him, but there's only one catch. Private practice is a business. I am not too much of a businessman, so I'm more into a serviceman. I'm more into a person who likes to provide service without taking care or worrying about the cost, because that is the issue when it comes to cost. There are things you can do and you cannot do. So I did work for about 9 months at private practice, wanted to join the government service, but then the posting wasn't that ideal. So having said that, the uni knocked my door again. Suddenly I got a call and they asked me whether I'm interested to join academics. And that's how I began actually, because that's the only other option to join a service, to provide service, and hopefully with less issues about cost. I was roped in as a training tutor. It's a contract job. All right, we don't get scholarship, and the max is 3 years. So by the end of 3 years, I was quite desperate. One of my mentor, Professor Lian, managed to find me a job in the UK. They have this scheme called Overseas Dentist Training Scheme. That was in the 90s. I was lucky. They took me in. I get the job for a year, and that's where I actually trained further after my training in UM as a tutor. So all in, I have 3 years in UM, 1 year overseas, and those were the days when I passed my fellowship exam. The exam is the only thing that they needed. Those days, they don't need a master or PhD. Of course, that will be a that advantage. And that's how I ended up with academic qualification. Okay. So when I reached from the training overseas, I wanted to join UM. That was like in 96. Unfortunately, because I didn't belong to the group of trainee lecturers, I actually joined UKM. So for those of you who are from UKM, and maybe some of your curriculum that you've seen in oral surgery, we were the one drafting it in 96 when the school first started. I was the first lecturer appointed then. And from UKM, I moved on to UM. The reason is I wanted to study. UKM, unfortunately, do not have the avenue at the point of time. They were new, whereas I want to carry on and study. As I say, you have a master, you have extra advantage. It's a knowledge thing. And I went to UM. They allowed me to do a part-time master, which I did. And of course, that is a drag because you're doing it part-time while working. You know, it dragged for years and years. And I finished that. And that's how I ended up in UM ever since the millennium until now. So I passed 20 years in UM.
Prof, you specialize in oral and maxillofacial surgery, right? So could you just, kind of elaborate about what this specialty is about and, how you decide on pursuing this specialty?
Okay, right. Oral surgery, I think everybody knows. Anything to do with the mouth, surgery. But then if you look at the whole scope of oral maxillofacial surgery, and some people do even craniofacial surgery, they go up until the base of skull or area around there. Okay, so I started in the 90s. Those days were different. Our training is different. Our training is more fellowship, hands-on training. There's not really a big course that people follow like what we are actually training our doctors now in UM or UKM or USM. So my exposure were more on dental area trauma, a bit about orthodontic, and with some cancer work as well. So it's dependent on the center actually. If you look at whole Malaysia, some oral surgeons do cancer, some do not, but you will be surprised. From my experience in the US, the same actually applies. Of course, now in UM, my colleague actually do a lot of distraction, craniofacial, and also cleft. Okay, that is admittedly something that I do not do and I wasn't trained. and we have enough young people to train. So there's not a need for me to be retrained to do it. Why I chose it, long story, it all boils down to where I started when I was working in UM as a tutor. Because of my post, it wasn't a permanent post, with that it doesn't come with a scholarship. So I wasn't eligible for that. And because of that, I can't be going overseas to do a master and a fellowship, which was the norm then. So if you look at some of your consultants in KKM or even UM, they actually have a master in science in dentistry from UCL, that is actually Eastman, and a fellowship. So those days I actually started with a fellowship because I passed the exam. And as I said just now, that is why I actually ended up in UM again, because I wanted to do a master to make up for whatever I don't have. So I actually worked the other way around in a way. So why I actually end up in oral surgery, because that training actually allows us to do only an exam, in oral surgery. You won't allow us to do an exam in orthodontics, for example. There wasn't such a program in the past, in the 90s in Malaysia. And for others like restorative endodontics, yeah, you can, but my training in UM wasn't enough as a tutor, even though I was rotated in every department and every specialty. And the work in the UK is actually very hospital-based. So really hospital-based oral surgery or dentistry. That's how I ended up in the oral surgery, really. Yeah. So it's not by choice. It's kind of, that is the best situation you can get yourself in, actually. You guys are lucky. You have more choices. You can, it's just a matter of, your interest. Of course, finance is an issue. And if you need a scholarship, the years of service is an issue.
So moving on, in 2015, you were a visiting professor at the University of San Francisco in the United States.
Yep.
Do you enlighten us about your working experience there?
In university, we have a break. It's called sabbatical. It means that you don't need to go back to the university. You can go elsewhere. You can go to another center. You may spend that break. It can be between 5 months or 9 months, depending on your years of service. And you actually commit to something. Say, I want to spend that time writing a book. So at the end of the 9 months, let's say you take a break, you're supposed to produce that book, because that's the contract. So I chose instead to get posted to UCSF, that is San Francisco. The reason is the person in there there's a professor there by the name of Tony Pograo. He's an expert in nerve injuries in the US side. When I did my PhD, I did my PhD in between 2007 and 2010. I actually spent 3 years in Sheffield, UK, to learn about nerve injuries, the healing mechanism, and things like that. Because when I was working before that in UM, I did course, unfortunately we do, or we did get referral of people or patients with nerve injuries, things like lingual nerve injuries, inferior nerve injuries, and I was kind of lost because nobody in Malaysia actually treat them or are interested in treating them. So that's how I ended up in the UK, and that's how I ended up in the US. So I was there hoping to see some cases that we do, because when I was in Sheffield, I know how they do the surgery, I know how they do it. But then in the US, I actually wanted to see how much difference. Okay, but essentially they are the same. A lot of things we do in dentistry is universal. It's just a level of care. Maybe my care is higher standard than yours, right? Maybe we can spend more time talking to the patient, they cannot, or the other way around. So those are the things that makes a difference, because skill-wise is very individual. Of course, the training program will provide you with that. So I spent about 6 months there observing what they do, learning from their way of work. UK and Malaysia is very similar because we adopted the British system. US is basically all insurance-based. So you'll be surprised, how people come in, they have to get insurance approval before they get an operation done. You'll be surprised how small is the waiting area before operation, and you also will be surprised how small is the operation theater if you have been to one, okay, compared to some of that we have in Malaysia. And once you have seen those things, you realize we are quite luxurious in a way, okay? Why are they small? And not because it's just a matter of cutting costs, covering the cost, because everything in the US is insurance. So the government will not provide treatment like what we have done in KKM. If you are having an accident, you come in and get yourself fixed for, I don't know, maybe about 2,000, whereas the actual price for the whole treatment is about 20,000. So imagine how much the government is caring for the population here. it's an experience, a good experience. And of course, I stayed near the hospital, and the hospital actually, I mean, the dental school and the hospital is actually on a hill slope, overseeing the bay. They call it the bay, and you can actually see Golden Gate every day, the bridge. So that's the fun part of it. Okay, besides going to the hospital, you get to see the city of San Francisco. So I did spend quite a lot of time with them, seeing how they do the implants, implantology, and things like that. To me, it's more to learn and come back and then teach or pass on what I've learned. What's their philosophy, how they do things, why they do certain things. Yeah, we know we can read, we know we can YouTube, we know we can Zoom, but it's not the same experience. We are there. You can talk to them straight, in the face. You can question them. You can debate, that kind of thing.
You have been working actively in Malaysia for about 30 years. What is the most fulfilling part of being an oral and maxillofacial surgeon?
The job is not fun. I tell my patient one thing: I don't want to see them, right? Because if they're coming to see me, they will get operated upon. So something is not right with them. So I keep telling my patient, yeah, if I have a choice, even though I'm trained, I don't want to operate unless I have no choice. And if I have a choice, I will try and choose what we call the more conservative treatment. I know there are people who like to cut, and then we like to do big things. We do nowadays things like free flap, big surgery and stuff like that. But at the end of the day, the most fulfilling thing is learning about yourself. When you train as young age, you think you are Superman, maybe, right? In a way, you think you can do a lot of things. You know a lot of stuff. You know a lot of things we can do, or we can means the technology allows us to do. But then over time, you're humbled by it because some of the things that we do, we fail. Things didn't work out the way we want. Complication happens, and you tell yourself, and you tell people, you question people, you say, I follow the books, I follow my training, and then why? So the thing that I find most, if you want to say happy, is where patient feels good. They feel comfortable. I know they're in pain after that. I know they'll get swelling. I know maybe they can chew. Maybe they lost part of the jaw, but the interaction with them is where they appreciate. It doesn't matter if they don't give you gift. We do get gifts, pens, food, whatnot. It's never the issue. The issue is when you can see from their conversation, from their eye, they're happy because even if things goes wrong, they think that you've done your best for them. I think that is the most important thing as healthcare workers. It's not about ourselves actually. It's about them. How we try to help them solve their problem or actually minimize their agony if there is any. Yeah.
Yeah, that sounds very, very noble.
No, it's not normal. You learn over the years, like I say, you're humbled by it because at the beginning when you graduate, you think you can do everything. You think you can do a filling. It's perfect. It looks like a natural tooth. I've done it before. Okay. And then patient comes back with pain and they say, what's wrong? Well, they get palpitis. That's all. You may have accidentally cut the pulp horn, caused the infection, pain, things like that. You can't see it with the naked eyes, but that's reality. All right. And like I say, that's where, of course, patient may get upset, but if you can solve it, then they will still, most of them, I think, thank you for that because they know your intention is, I won't say noble, but your intention is actually to help them. So that is very important because we do the same with interviews. When people want to train as oral surgeon and people want to train in dentistry, what do you want to do the course for? I think you did question me somewhere. And, do you want to do the course because you want to do nice things? You think you want to do the course because you see some dentist with a big house, big car, whatnot? You say, yeah, we need money, agree. Everybody has family to feed, old people to take care of. We need money to survive. And it's not fair to deny somebody the same thing another person can make in the corporate world. Okay. Having said that, is how you balance the thing and both and patient are happy and you live a reasonable life, I would say.
Moving on, Prof, you have successfully published 176 research papers to date. What is the biggest challenge that you face in research, and what do you foresee about the prospects of research in dentistry?
That's a tough question, isn't it? Right. I mean, the problem with academics is there's always this word called publish or perish. I started my publishing very early because my mentor then, the ex-dean of Dr. Hashim, got me off then. My first paper was was something that I do in the blind. I would say blind, okay, because I honestly don't know where to start, what to do, and things like that. But then when you get a task to do it, you have to figure out. So it's a bit like problem-based learning. You figure out how to do it. You look at other people doing it. We don't have YouTube those days. We don't have webinar and things like that to teach you. So we depends on whatever people have done and say. And that's how I got started. And I mean, the good thing is, fortunately, I was quite a good writer. When I was in secondary school, I wrote quite a lot of work in Malay, published it in newspapers and magazines. I took it as actually a training because, you know, where else to get a training? If you can send something to somebody and they publish it, that means your writing is not too bad. Okay, so the same rules applies when it comes to dentistry academics. My teacher always says, when you publish something, your idea, your argument, or something like that, will get closer to the expert, because when you send something for publication, it will be reviewed, it will be read by somebody who is an expert. If the expert thinks it's good, he will recommend publication. If you think it's bad, sorry, you'll get rejection. I still get now. And of course, like you asked, publication is getting tougher and tougher. I started early, so I was fortunate to say I started early. It's just a bit like people who wants to start a clinic now compared to a person who wants to start a clinic 20 years ago, right? You started early and things like that. But having said that, every generation has the competition. Every generation has the challenge. Different time have different perspective thing to be thrown onto you. So I think we should not fear it, all right? Should not fear it. If I'm born now, I will tackle it in a different way. Now I can actually write a paper just sitting in the room here, for example, without going anywhere, because I can get the resource, get information, everything from internet. Those days we have to run to the library, find the thing in hard copy, and sometimes the library do not have it. We have to get it from another library, and it costs you a lot of money just to get the printed records or document sent to you, and those take ages. So you can actually take you a month or two to finish up a paper, because you're doing it halfway and then you say, I have to wait for this to come in so that I can add on information and stuff like that. So those were the challenge in the past, right? So with digital thing, I managed to even finish one paper in one day. So that's how quick you can do it. Yeah, but it's not the norm, I have to say. I believe there's always a lot of things to learn, because the interesting thing is we always thought we know everything. We always think that we are in the modern science era. But if you start digging up the history, okay, history as history, not history as what we learn in school, of healthcare, especially dentistry, you will realize a lot of medical care, whatnot, started about 100 years ago. The real thing that we do on patients, the invasive thing. I know you learn about GB Black and the caries, but that was like 150 years. So that may be a bit older. But then if you look at oral surgery and more recent stuff, you notice certain things can only do with what? General anesthesia. Those days we started with ether and stuff like that. We learned that in school. Local anesthesia, and if you learn, you realize your LA that we use for patient is only invented in around 1960s. Okay, some of your painkiller that you have actually were just invented 20 years ago. Of course, you can say Panadol, aspirin, stuff like that are so long. Having said that, if you count plus, minus, add everything up, you'll notice it's about 100 years. So how much knowledge have we moved in dentistry? Actually, in digital, in material, we move very fast. In oral surgery, in some other pockets, like to me, like dental anatomy, oral anatomy, we are still a bit behind. Behind as there's still a lot of gaps. There are a lot of, let's say, if I'm going to ask you a question in return, what is the root length size of all the population in Malaysia, including Kadazan, Ibans, Bajau, the Orang Asli? I don't think anybody has the answer. And I'm still collecting those data because that is what I do. Do not as a researcher, but do on the patient. If I want to treat them, I want to do an extraction, if I want to do a canal or surgery, I know where to cut, what is the length, what is the size, where's my limit and things like that, because my data is on the people that is around me. There's a lot of questions that needs to be answered and the room is there. Of course, if you're doing something else like digital, you're doing something else like material, we are not that strong. because the resources, the company, the lab all cost a lot of money, and they are actually, a lot of them, dependent on the manufacturer, which unfortunately, if you look at Malaysia, we are too good at what? Making gloves. We are number one, right? You see the share market, the glove company are all booming, like nobody's business. But then we don't make anything else. We don't make composite. We don't make dental instruments. If your friend who comes back from Pakistan or India, they actually bring their own instrument back because they actually required to buy, and they were made in those countries. We don't. So we are not strong in this area. We are strong in certain areas. So it depends on us which direction we want to go. As far as research is just 100 years, there's a lot of room to us to learn a lot. I don't think it's a problem. It's a matter whether you can catch it or not.
Okay, Prof, what characteristics do you think is required for a student to pursue oral and maxillofacial surgery?
It's actually about the person. Whether you are patient enough to do it. Patience means that you don't rush through things. You have the passion, means that you really believe and love doing it. Oral surgery, unfortunately, is not a fun specialty. Okay? Oral surgery, you close your clinic at 5, you actually go on call after 5. And that will go on for the rest of your life, which is what I've done. Okay? And of course, when I first started, I didn't know about this because, like I say, when you're young, you think you want to do everything. You think you can do everything. You do not mind anything, which is a good thing. Yeah. So the most important characteristic actually is somebody who are resistant to stress. In a way, somebody who is not too bothered by certain things. Unfortunately, like we learn to dissociate ourselves from our patient. Okay, we don't get emotionally too attached to things like that because in oral surgery, patient dies. They die from trauma. They die from accident. Trauma. They die from cancer and all these things. Yeah, and sometimes they die from general anesthesia accident. So they do die, and those are things that really emotionally drain us. And most of us will face this somewhere in our career. So if somebody has the character that can take all this, all right, and yet survive that person would be a good choice. All right. So you yourself must, you mean anybody in the future who wants to join this program must know who are you, because we have people who drop out of the training program, who failed the training program. Yes, they do. Not only in Malaysia, anywhere in the world. You have to judge yourself.
Thank you for the answer, Prof. So the last question will be, what advice would you give to the current batch of dental students who aspire and look up to you?
Don't need to look up to me. Okay, first question. First answer, okay? We always want somebody to look up to. Personally, you will notice I don't promote myself because I don't think I should be the one you look up to. The first rule is to love yourself. Look up to yourself, your family around you, and people who support you, because they are the real people who know you the best. Okay? Whoever you think you look up to, you only see half of the story. If I were to post in the social media, for example, I won't post about my failure. I won't post about my patient who died. I won't post about blah, blah, blah that is negative. You notice that we are all human after all. We're not perfect. We may have issues with our friends, our colleagues, our families, and whatnot. And yet, if you look at the social media side of it, you say, wow, this person is great. That's how we sell ourselves. Okay? And of course, some of you, like in my uni, we have mentor-mentee, but half of the time we only met them every semester once. Often, sometimes I give them the choice to ask for advice from somebody they're comfortable with, because the person you get may not be the person you're comfortable to tell your problem, right? Or some issues may be religion-based, so I may not be able to help them, for example. So just go around. There's a lot of people who love you next to you, and that you should start with that before looking up to people like me. Okay, what I'm trying to do all the years is just to raise the level of dentistry in the country. Things like you say, why I write so much paper. One is a requirement. Two, if you don't do it, okay, let's look at it. If you don't do it, somebody has to do it. But you can't wait for the next guy and say, come on, do it. So you have to lead. That's our duty. That's our role as the senior people. Okay, so you can look it up on that spirit that you want to achieve this, you want to train for this, you want to write this, you want to do this research. That's fine. I think that type of looking up is good. Yeah, look up to all the people who give you positive energy. That's the simplest advice I would give.
Thank you, Prof, for the very real and down-to-earth answer. Let's move on to the most exciting part of the interview, which is the rapid-fire round. Are you
That's
ready?
the toughest part.
If you had to eat only one type of food for the rest of your life, what would it be?
I don't know. I think it's just noodle.
Two.
Any noodle, okay. Any noodle. That's
3
all.
words that you would use to describe yourself.
I am me.
What are your hobbies?
My hobby is actually reading. Very boring. A lot of people don't like reading because nowadays we got a lot of social thing and then we read from the tablet, but then they are not real reading. What I mean is you get a book to read, a novel to read, autobiography to read, this kind of reading. I notice less people are doing that. But Asian are not that good at doing that. Not to say I'm not blaming them. Whereas if you go overseas, people see people walking with a book in the bars and whatnot. I don't see them in Malaysia. Yeah, I hope that we do that because knowledge is what grows us.
If you weren't a dentist, what would you be?
Gosh, my favorite subject was history, so I may become a teacher in history.
Do you remember the last movie you watched?
Let me think. I watched too many movies actually. So, the last one is actually an Indian movie, Ngeow.
3 things you are grateful for in life.
Actually, I don't have 3 things. I just have 1 thing only. I'm just grateful in my life. That's all. Things have been quite good.
Fair enough. So number 7, what is your dream holiday destination?
I guess Paris. I went there once, but then we went in the middle of winter. And we spent 3 days in Disneyland and 1 day in Paris. So I didn't get enough of Paris.
Do you have a favorite quote? If yes, what is it?
Yeah, good question. Really rapid fire. Now I cannot think of any very good. Just be grateful.
Do you have a favorite celebrity?
Gosh, that's even tougher now, isn't it? I think Obama would be a good character that I would look up.
Okay, and the last question, what is an advice you would give to your younger self?
I think maybe keep my temper cool.
We have come to the end of this interview, Prof. Thank you so much for being so sporting and answering all the questions. Okay, so see you all in the next episode of Interview with the Expert Season 5. Bye!